Hello everyone, my name is OLAWUYI OLUBUKOLA. In this video, I will be talking about artificial ventilation, which includes the golden minute. After preparing for birth and the baby is born, if there is meconium, we clear the airway and dry this baby thoroughly. If the baby cries, the baby falls in green zone. A baby who does not cry falls under the yellow zone. So this baby not crying, we can see the color is gray or bluish. The baby not crying, we need to clear the airway quickly, and we need to clear the mouth, suck the mouth before the nose, and we don't need to suck for too long. Smartly, do it smartly and come out. Also, we now need to stimulate the baby. Stimulation comes with, we can use the wrapper or the whatever we use in covering the baby. And when we are stimulating, we allow some pressure so that this baby can feel our hand. The baby can come round, baby can begin to breathe. The baby can also go back to the mother and continue skin to skin care with the mother. But we continue to evaluate this baby. This baby is not breathing. First 30 seconds we stimulate. The next 30 seconds, the baby is still not breathing. We need to take our equipment, that is the bag and the mask, and ventilate the baby. And when the baby is on the mother and we suck the baby, we need to put the baby in slight extension, extend the neck so that hair can go into the neck, so that in a slight extension, we don't allow the baby to flex the head. Extend slightly, and with the use of appropriate size mask, we ventilate. The mask will cover the lower chin, the mouth, and the nose of this baby, and you ventilate at, and we say breathe 2 3, 1 2 3, 1 2 3, 1 2 3. I do that for 40 cycles per minute, and after doing that, we continue to evaluate this baby. After evaluating the baby, and the baby is still not breathing, so the first 30 seconds you stimulate. The next 30 seconds, the baby is not breathing. That is the golden minute. The golden minute, 1 minute of birth, the baby should be breathing, or you breathe for the baby. 1 2 3, 1 2 3, 1 2 3, 1 2 3, 40 times, 40 cycles in 1 minute. And when the baby is still not breathing, if the baby is breathing, the baby can still go back to the mother, but we'll continue to monitor this baby very well. If the baby is not breathing, we now need to call for help. After calling for help, we need to improve ventilation. Improving ventilation means checking yourself as a healthcare worker. What am I doing that is not, I'm not doing right? We need to reposition the baby's head. We need to check the bag, if the bag is leaking, because when we place the mask on the baby's face, it has to form a good seal on the baby's face so that it can be effective, and we can actually see the rise and fall of the thoracic area, and we can see the breathing of this baby. So we need to squeeze harder. We need to suck the airway if there is secretion in the airway, and also reposition the head and squeeze the bag harder so that the baby can breathe very well. So continue ventilation for 1 minute before stopping to listen to the heartbeat. That is why we need this stethoscope. We need the stethoscope. A stethoscope can be used to prick the heartbeat of this newborn, because at that time you may not have an helper who can help to check the umbilical cord position. And if you are the only one as a health worker, you can actually check the umbilical cord position, but you need not be anxious, because if you are anxious, it is your own pulse you'll be picking instead of picking the umbilical cord of this baby. So you can count for 6 seconds and multiply whatever you get by 10, and it will tell you maybe you to continue ventilation. So it's possible to continue ventilating this child and the baby respond. At times the baby will not breathe, but the heart rate is there. So a heart rate of 100 is normal for the baby. So, but if the baby is still not breathing, then you continue to ventilate this baby with bag and mask. So as a skilled birth attendant, the most important thing in helping baby breathe is the ability of the healthcare worker to be able to use the bag and mask effectively to help to save the life of this baby. The golden minutes is very, very important in the life of this baby because we do not want any baby to have brain damage. We all know that when a baby's brain is damaged, what is left of that baby? So as our jury, as women, as our jury is important to us, so also is this golden minute is important to this baby. So as healthcare worker, I must emphasize, when we stimulate, don't let us overstimulate this baby. Don't let us turn the baby's head down. Don't let us squeeze the rib. Let us not give injection to this baby. All these actions are all time wasting. And what we are talking about in HBB or helping baby breathe is timeliness, giving attention to this newborn so that they can survive.